Welcome to my channel. SCFHS Physiotherapy License Exam Most Important Questions and Answers. Which nerve is most commonly injured in a mid-shaft humerus fracture? A. Ulnar nerve. B. Median nerve. C. Radial nerve. D. Axillary nerve. Muscle that work the most in respiration. A. Intercostal. B. Diaphragm. C. Abdominal. D. Intercostal after. Patient have stroke can't clear toes from floor during gait analysis. What is the cause? Weakness of dorsiflexors. Which from the following can turn chemical energy to mechanical energy? A. Small intestine. B. Stomach. C. Skeletal muscle. Postnatal. To minimize the risk of complication of immobilization such as DVT. Ask mother to early mobilization. Contraindication of exercise in pregnancy. A. Gestational diabetes. B. Pain. C. Musculoskeletal discomfort. In controlled diabetes, PHYSIOTHERAPIST orders patient to do exercise to A. Increase glucose uptake by muscle. B. Increase insulin metabolism. Patient have facial palsy that can't close the eye. What muscle is affected? Orbicularis oculi. Orb Ingram. Injury to C5-C6 brachial plexus. Clonus in which lesion? A. UMN. B. LMN. Patient 12 years with right facial palsy can't look to the right. Which muscle affected? A. Lateral recti. B. Medial recti. C. Superior oblique. D. Inferior oblique. Postoperative arthroplast. Complication. A. Fracture. B. Dislocation. C. Infection. Supraspinatus muscle palpation. A. Slight abduction with internal rotation. B. Abduction with external rotation. A positive Trendelenburg sign indicates weakness of A. Gluteus maximus. B. Gluteus medius. C. Iliopsoas. D. Hamstrings. Which fracture is treated by traction? A. Femur fracture. B. Ankle fracture. C. Knee fracture. Which nerve is most commonly injured in a mid-shaft humerus fracture? A. Ulnar nerve. B. Median nerve. C. Radial nerve. D. Axillary nerve. PT put patient in prone and knee flexion and start make compression of the knee joint against the plinth and make twisting movement lateral and medial to test a ligament tear. B. Meniscal tear. Tremor. Is an involuntary, somewhat rhythmic, muscle contraction and relaxation involving oscillations or twitching movements of one or more body parts. It is the most common of all involuntary movements and can affect the hands, arms, eyes, face, head, vocal folds, trunk, and legs. Most tremors occur in the hands. Patient with partial ataxia. PHYSIOTHERAPIST make contraction and no movement is placed in limb. A. Rhythmic stabilization. B. Rhythmic initiation. Which nerve is most commonly injured in a mid-shaft humerus fracture? A. Ulnar nerve. B. Median nerve. C. Radial nerve. D. Axillary nerve. Which condition is characterized by resting tremor, rigidity, and bradykinesia? A. Multiple sclerosis. B. Parkinson's disease. C. Cerebral palsy. D. ALS. Patient walk using crutches. Patient first make to elbow crutches move forward, then make to lower limbs advance. A. Swing to B. Swing through C 2-point gait. D. 4-point gait. Patient with ankle sprain injury have pain and red color after take analgesics and rest the pain subsides. Which grade of ankle sprain? A. -1. B. 2. C. -3. D. -4. Patients can't make hyperextension of shoulder and put his hand in his pocket according to SCFHS. Of activity limitation. B. Impairment. C. Disability. Define cadence. Cadence is the rate at which a person walk expressed in steps per minute. The average is 100 to 115 steps min. A patient complains of back pain. Relieved by flexion shopping cart. Sign. Diagnosis. A. Disc herniation. B. Spinal stenosis. C. Spondylolisthesis. D. Facet syndrome. A patient presents with shoulder abduction 0 to 15. Which muscle is not primarily responsible? Deltoid B supraspinatus, C. Infraspinatus, D. Teres minor.